Does Gua Sha really live up to the hype, or is it just an expensive trend? From easing low back and neck pain to getting rid of wrinkles and even diabetic neuropathy symptoms, this ancient practice promises a lot. But is there real evidence behind it? Can it truly boost circulation and relieve migraines, or is it just another wellness waste of money? In this video, I will delve into some of the science of Gua Sha. Welcome to my channel. I share evidence-based content for women who are over 50 and interested in healthy aging and longevity. Gua Sha is a traditional Chinese healing practice that dates back over 2,000 years. It was used as a folk remedy to treat various ailments, including fevers and muscle pain, and involves scraping the skin with a smooth-edged tool to stimulate circulation and promote healing. The name Gua Sha translates to scraping sand, referring to the red, sand-like marks that often appear on the skin after treatment. Although it was historically used in rural areas by families as a home remedy, it has gained popularity in recent years due to its reported effectiveness in relieving pain, reducing inflammation, and supporting overall health. Today, it's practiced by trained professionals and even integrated into modern wellness routines. Here are 6 ways Gua Sha might be beneficial for your health. 1. Improvement of symptoms of diabetic peripheral neuropathy. Diabetic peripheral neuropathy, DPN, is a common complication of diabetes that affects the nerves, primarily in the extremities like the feet and hands. It results from prolonged high blood sugar levels, which damage nerve fibers. Symptoms often include pain, tingling, numbness, or weakness in the affected areas. The pain of DPN is often challenging to treat. DPN can also increase the risk of injuries and ulcers, particularly in the feet of diabetics, due to reduced sensation and poor wound healing. So finding helpful treatments is important. A randomized controlled study was published in the March 2019 issue of the journal Complementary Therapies in Clinic Practice, where 60 subjects were treated with Gua Sha once weekly for 12 consecutive weeks, and 59 received usual care. The study reported that at the 8-week and 12-week post-intervention assessment, Gua Sha therapy significantly reduced the severity of neuropathy symptoms, improved performance of sensory function, reduced peripheral artery disease, and resulted in better glucose control compared with the untreated group. While this study suggested that Gua Sha therapy may be a promising treatment in reducing the symptoms of patients with DPN, additional research with a larger sample size is required to help confirm the effects. 2. Relief of low back pain. Chronic low back pain is a public health problem and a major cause of work absenteeism and disability. Given that an optimal clinical treatment has yet to be identified, patients often seek complementary and traditional therapy treatments. A study published in the journal Complementary Therapies in Clinical Practice looked at 50 patients with chronic low back pain. 25 were randomized to receive Gua Sha treatments and 25 received none. The researchers found that patients who received the therapy reported improvement in their chronic low back pain and their overall health status. They concluded that Gua Sha appears to be safe and effective in patients with chronic low back pain. Since the study had a small sample size, further rigorous studies are needed to confirm and expand upon these results. 3. Relief of neck pain. Neck pain is a common disorder. Arthritis, trauma, and even long-term stress Lack of social support, anxiety, and depression are all important risk factors for neck pain. A March 2011 study published in the journal Pain Medicine randomized 48 outpatients with chronic mechanical neck pain. 24 received Gua Sha treatments, and 24 were treated with a local thermal heating pad. The patients were followed for 7 days. Neck pain severity after 1 week improved significantly in the Gua Sha group compared with the group that did not receive Gua Sha treatment. Significant treatment effects were also found for pain at motion and dimensions of quality of life. The researchers concluded Gua Sha has beneficial short-term effects on pain and functional status in patients with chronic neck pain. The value of this treatment in the long-term management of neck pain and related mechanisms remains to be clarified. 4. Gua Sha is commonly used to improve the skin, but does the evidence support any benefit? Currently, there is limited information about the use of this treatment for cosmetic improvement. A June 2020 case report published in the Journal of Chinese Medicine shared the results of using Gua Sha in the treatment of facial expression lines and wrinkles. The results showed improvements in both, as well as improvements in skin texture. Since this was a case report, further studies are recommended. 5. Improvement in microcirculation. Improved microcirculation is believed to enhance the delivery of oxygen and nutrients to the body's smallest blood vessels, support cellular health, and improve wound healing and skin appearance. A 2007 pilot study examined the impact of Gua Sha on microcirculation. Using laser Doppler imaging, the researchers observed that this treatment significantly increased microcirculation in the treated area for up to 25 minutes post-treatment. It was further suggested that this increase in blood flow may contribute to the treatment's pain-relieving and anti-inflammatory effects, as well as the improvement of muscle aches. 6. Migraine relief. A case study published in October 2007 was said to be the first case study to report on the use of Gua Sha for treating migraine headaches. The 72-year-old woman who suffered from chronic headaches was said to benefit from treatments during her 14-day inpatient multimodal treatment. More research needs to be done in this area. However, Gua Sha appears to show promise as a potential adjunct in the treatment of migraines. So, is Gua Sha worth the hype? Well, it may be more than just an ancient practice, and seems to have promise for promoting health and wellness with very few reported adverse effects. That said, more research is needed in this area to confirm some of the findings. If you choose to try this treatment, consult with your physician, since medications such as blood thinners in the setting of intense pressure could have adverse effects. Also, consult with a trained practitioner who can guide you through the process safely. Remember, investing in your health today is the best way to ensure healthy aging and longevity. Don't forget to like, share, and subscribe.